Awesome. Well, good afternoon, everybody. My name is Andrea Strohmeyer, and I am a science educator at the Health Museum. Today, we are on with, wow, my computer just went blank. Can everyone still see me?
Yep.
Okay, awesome. Sorry, I don't know what that's about. I am on today with Vaughan Gilmore. She is the director of addiction services over at the Menninger Clinic. She leads a team of 15 counselors that are specifically purposed to help people through chemical dependency. And today we are going to be talking about new solutions for overcoming substance use. And I feel like this topic is incredibly appropriate, especially since COVID. The American Psychological Association has taken a survey and discovered that 1 in 4 adults drink more alcohol with COVID in order to manage stress. And that has especially been problematic in households that have children under the age of 7. So, Vaughan, you can go ahead and take it away.
Awesome. Thank you, Andrea. Thank you for having me here. I'm super excited to be sort of talking about substance use and what's going on with substance use, particularly alcohol use. With COVID, some strategies for parents, thinking about strategies people can use for cutting back on their own alcohol use, modeling healthy coping strategies for your children, and really understanding sort of the relationship between sort of mental health and alcohol use, especially with COVID going on. And we'll be happy to answer questions at the end, so you can put them in the chat as we're going. So just a little bit of an overview on really what we see in terms of the impact of COVID on mental health. What we know is the experience of social distancing, isolation, quarantine has been incredibly difficult for people. It's been stressful. It can be sort of traumatizing, the level of isolation, particularly isolation that parents with young children are experiencing. There is a sense really of grief and mourning for a life that really looks different. You know, we're thinking about getting back to normal, but really a new normal. So there is this sort of loss that's happened over the past 18 months in terms of what our lives looked like. Just an acknowledgement that change is difficult for everyone. It can leave us feeling very exhausted and with a lower sort of tolerance for stress. So we're seeing just in general, people have a lower frustration tolerance, meaning our sort of level of resilience and reserve for managing stress and frustration is just lower than it would normally be. And we're seeing really increased substance use as a way people are reporting to cope with all of that stress on their mental health, on their sort of financial situation. We're seeing increased alcohol use. We're seeing increased use of other substances as well. I'm mostly going to talk about alcohol today, but just overall, we are seeing that Americans are reporting more substance use in order to cope with stressors. So what are sort of some of the specific things we're seeing in terms of COVID-19 and its impact on substance use? We're seeing an increase in use as a result. A lot of the economic crisis, there's sort of previous research showing that during a time of economic crisis, people's substance use goes up. People often use substances as a way to manage stress or to cope with life stressors. We are also seeing that people might be using more substances because they don't have access to the same level of social support or community resources. This is also why we are seeing some people who might have had some what time we call like in recovery or in sobriety that are having relapses, right? They're returning to substance use because they don't have access to the same level of support and community engagement that they previously did. Right, the heightened sort of anxiety is leading people to use in order to cope. It's very common for people to sort of use substances to cope, and that's really been kind of normalized in our society, right? We regularly talk about after a hard day, right, going to get a drink, going to happy hour, things like that. So we're seeing people sort of do that. We're also seeing that people just don't have as much access to treatment or support networks to sort of help them make these types of changes. If somebody is interested in cutting back or stopping using, they might not have access, both because of restrictions and then also because of maybe their economic situation. Part of the impact too on substance use is a loss of structure. Really, most of us benefit from the structure of work, of obligations. It kind of helps us figure out how to live our lives on a daily basis. And when we lose a lot of that structure because of lockdowns or because of unemployment or working from home, even, we're seeing more people like sort of using substances. We don't have the same outlets that were sort of keeping us accountable previously. And then I mentioned really the economic challenges that can lead people to use, again, to sort of cope with those types of hardships. I just want to share a couple of images. These are a little bit old. These are from early on in the pandemic, but there really was this sort of messaging going around social media in particular, like stuck at home with your kids or working from home, like it's okay, just drink more. This was really sort of communicated and normalized within our culture that really right now is the time that people might be drinking earlier in the day, throughout the day, or drinking like larger volumes, right? That all of a sudden, like the rules of like maybe when it's okay to drink alcohol or use substances didn't apply anymore. People were, right, these allude to the things that I just talked about, people being stuck at home, people being bored, people not having to go into work. And we're not really seeing this as much anymore, but early on, this was really circulating heavily, this idea. And now we have research to sort of support that really is what was happening. So I'll talk about a couple of different research studies, but one, this is a survey of about 800 adults where they asked just about alcohol consumption during the COVID-19 pandemic. And 60% reported an increase in drinking. There were some people, about 13%, that reported a decrease in drinking. Some of the reasons for the decrease might have been like less time because they were more busy with childcare or sort of less financial resources to drink alcohol. But we saw the sort of greater increase in drinking as a result of stress, which I've talked about, availability and boredom. And I think that boredom is a really important one. We see that when people don't have as much structure, as much going on in their lives, they might be bored, they're stuck at home, that they are using alcohol to sort of cope with that boredom. And that's a little bit different than just people coping with stress. That's really more people not having the same level of structure or things going on and drinking to manage some of that boredom. They also found in this study that the people who experienced sort of COVID-19 stress reported drinking more drinks and a greater number of days actually drinking. So a direct relationship there between sort of stress from COVID and increased alcohol use. This is just the same data. This is the sort of study that this came from. Again, you can see sort of an increase, 60% of the people reporting an increase in alcohol use. Another study I'll share with you, this actually references sort of the initial increase in alcohol sales that we saw. So in March 2020 compared with 2019, a 54% increase in alcohol sales. We've seen a lot of changes in terms of how people are drinking alcohol in the past 18 months, here in Texas with changes in the laws and alcohol delivery and availability. What they also saw was sort of the consequences of COVID leading to some of those changes in alcohol use. So this study has sort of two different collection points. One in 2019 that actually was done before COVID, and then one in early 2020 in the spring, sort of right after the lockdowns. And what they found, this was sort of self-report from adults, is adults were reporting, drinking more, right? 1 day more per month. By 3 out of 4 adults. interesting and really important here for women who we know are often the primary caretakers, a significant increase in what they classify as heavy drinking days. And I'll talk about what heavy drinking is a little bit later in the presentation. They also found for women just an increase in the problems associated with their alcohol. So they completed something called the short inventory of problems scale. And basically for 1 in 10 women, they were having more problems associated with their alcohol use. So not just an increase in alcohol use, but also sort of the associated problems. So what we know about alcohol use and mental health is that these two things are really strongly related. Excessive alcohol use can actually worsen existing mental health problems. But there's also, there's sort of a cyclical relationship here. It's very common for people that might have depression or anxiety symptoms to use substances, including alcohol, in order to cope with how they're feeling and to sort of get some relief from those symptoms. However, what happens is the alcohol use can actually make those symptoms worse in time. We also see with alcohol use that there's an increased risk for family problems, for violence, there's alterations in judgment and decision-making, and really importantly, the relationship between alcohol, mental health, and sleep. Regularly, people describe using alcohol maybe to help them fall asleep or to relax, but what we know is alcohol negatively impacts quality of sleep. So if somebody is drinking to help with their sleep, it's actually making things worse. And then sort of poor sleep, not getting enough sleep can worsen mental health symptoms like depression or anxiety. So again, really complicating the picture. I do want to share a recommended resource if you or somebody that you know or you care about, if there's sort of any red flags about alcohol use. This is a sort of self-assessment. It's called the audit. This is a free, confidential, you don't have to enter any personal information. We probably can put this link in the chat for people to be able to click on as well. But this is sort of a very brief questionnaire that you can take, and it will just give you some feedback. It will take less than 5 minutes feedback on sort of the health sort of risks associated with your alcohol use. So you can share this with somebody that you are concerned about, to kind of just get a little bit of feedback about where your drinking falls in terms of your patterns. I'm going to talk a little bit about sort of what is a standard alcohol drink and then what is considered sort of low risk versus high risk alcohol use for parents. And it's kind of important to have a shared idea of what an actual drink is. So we consider a drink to be like one beer, a 12-ounce beer with a 5% alcohol content. And that's important because I know there are a lot of sort of higher content beers and drinks on the market nowadays. Or one 5-ounce glass of wine. And again, that's 5 ounces, sort of. So when we see these sort of images of people pouring these huge glasses of wine, well, that's more than one drink. And the same thing with liquor. 1.5 ounces is considered a standard drink when we're talking about 40% distilled spirits. So based on that standard drink information, there are some pretty clear guidelines on what is considered to be low risk alcohol use, and that's referring to low risk in terms of health risk. So for women, that's up to 1 drink per day for women, one of those standard drinks a day, and up to 2 drinks a day for men, obviously of 21 and up here in the US. And so that's up to 7 drinks a week, 1 per day for women to stay in the low risk range, and up to 14 drinks, 2 per day for men to stay in the low risk range, meaning lower risk of developing an addiction, lower risk of health consequences. We also have binge drinking and heavy alcohol use on here. So binge drinking is going to be referring to drinking sort of large amounts within a short period of time. And then heavy alcohol use is going to be sort of regularly drinking 4 or more drinks for men or 3 or more drinks for women, or engaging in binge drinking regularly. So we really start to see sort of the cumulative health effects of alcohol use when somebody is in this heavy drinking range. So how does this impact families? We know that addiction or substance use disorders impacts the stability of a home, the family sort of system as a unit, the mental and physical health of all the family members, both the children and other adults in the home, the finances, and overall the dynamics in the family. We know that any type of sort of substance misuse by a family member is an incredibly stressful life circumstance for everybody involved, whether it's a child that's having problem substance use or a parent or an adult family member. It impacts everybody. And this is important because the difficulty and stress associated with managing that or coping with that puts a lot of additional sort of health risks and burden on the other family members and can actually lead to physical and or psychological problems for the other family members in the home. Specifically with children, when there is substance use, heavy substance use or substance use disorder or addiction in the home, we see an increased risk of emotional and behavioral problems for kids. Things like an earlier onset of substance use by children that grow up in this type of home, a faster acceleration in their use patterns if they do also start using, and then later a higher rate of alcohol and drug use disorders as well, because we do know that there is quite a bit of risk genetically inherited from having a parent or a family member with addiction, but this is also referring to what it's like to grow up in the home when somebody is using substances. Also, sort of children that grow up in homes with addiction have sort of poor academic outcomes, higher rates of anxiety, depression, mood disorders, other behavior problems, self-esteem problems. So it can be pretty impactful on children. Just a little bit more about sort of the impact on children specifically. They can demonstrate sort of problems with communication, behavior, and all of this really illustrates what's happening in terms of modeling and learned behavior. So growing up in a home with a parent with a substance use disorder can be quite traumatic and stressful for a child. And it also is just modeling for a child how you cope, right? So if they see you using sort of substances or alcohol as a way to manage stress and solve problems, they are learning that from you. So we see a lot of learned behavior here as well. So if you or someone you know is thinking about cutting back on their alcohol use, there's quite a number of benefits that we see. And this is like heavily researched in terms of seeing improvements in sleep, energy, memory, overall physical health, and significant reductions in health risks, because we know heavy alcohol use is associated with a lot of health complications, and for women actually cancer risks as well. Cutting back on alcohol use can improve your mood, improve your family dynamics. You'll have more money and just better coping. And what is important to understand here is, I think historically we've expected people either to drink or to not drink, but a lot of people can actually successfully just cut back, take a break, reduce their alcohol use. I'm going to share a couple of resources for that if you're interested, but it's not an all or nothing. It's not a I can either drink or not drink. You can think about just cutting back or reducing your drinking in order to get some of these benefits. I have some strategies here. If you or someone you know is thinking about just cutting back, reducing their alcohol use, there's a lot available out there on how to do that, either on your own or with some professional support. But here are some of the recommendations: is really pacing in terms of drinking with food, having water, avoiding places that primarily serve alcohol. So if the place that you're going or the purpose of the function is just alcohol use, maybe limiting sort of your involvement in that activity. Cutting back on spending time with friends where really the behavior or the activity is focused on heavy drinking. So sometimes that means making some changes in your social situation. I regularly recommend to people to have an answer prepared, right? If you are worried about going to a social event, maybe a work event where people will be drinking and might ask if you want a drink, having an answer prepared for why you aren't drinking in that situation can be very useful. Whether it's, I have to get up early tomorrow, I'm not drinking right now, I'm taking a break, right? I'm working on sort of whatever it might be that's going on in your life, you can sort of have an answer ready to give. Some clients that I work with just say, I'm taking medication, so I'm not drinking right now, right? And usually people won't ask any more questions after that. It can also be helpful to keep track of how much you are drinking. There are some tools as well that I'll share that can be very useful for monitoring that, some phone apps, some things like that, where you can just monitor that. Really being clear and focusing on your reasons for why you want to cut back. I went over a lot of the health consequences and the sort of impact on children and family members, and so some of those might be important. Also, if you need more help to cut back, like there is nothing to be embarrassed about. There's a lot of professional resources and self-help resources available. It can also be really helpful just to focus on other activities, other skills, other hobbies, and particularly other like stress management skills for people that might be drinking to sort of manage stress, like really cultivating some other skills during this time. Just a couple of other things when we think about kids that might be in a home, or if you have a family sort of history of substance use and addiction and you're concerned about this, or maybe you've made a change and you're thinking about how to help your children with that. What we see in terms of protective factors for children that can protect against substance use disorders and addictive disorders is parental involvement. Really a focus on sort of communication, within the home, like focusing on the relationship. When it comes to drug and alcohol use, having clear limits and expectations around that behavior, not being sort of punitive or restrictive, but just clear limits. Age appropriate monitoring, so really knowing what's going on with your kids. Certainly there is a difference between, a 12-year-old sort of wanting to experiment with substances versus an 18-year-old. So some age appropriate monitoring. There's a lot of research on just engagement in pro-social activities. Kids that are busy and engaged tend to have less time to sort of get into substances. And then a lot of time just spent encouraging, reinforcing healthy behaviors. So modeling healthy coping strategies, engaging in healthy coping and healthy behaviors together is quite protective. And if you have questions about talking about drug and alcohol use with your teens and your children, this is whether or not you're concerned about their use, or you maybe have made a change to your own use, or you have a family history, just some strategies for how to talk about that. One is to make sure you're starting those conversations at a time of low stress, right? We wouldn't sort of initiate a conversation about this when someone's gotten caught or they're in trouble. We would sort of be planful. We're not in a rush. Nobody's stressed out. Maybe we've initially started talking about something else, and then we're able to transition to this topic. Using open-ended questions can be very helpful to get an idea of what they've observed, right? What questions and concerns they might have, what information they might have, what misinformation about substance use they might have. A lot of active listening and what we call I statements. So really taking in what they're saying, trying to understand it, making sure you've got it right, and then sharing any concerns you might have with what we call I statements. So that would be, I am, concerned when, right? As opposed to accusatory statements. Avoid any arguments or sort of really heavy restrictions. offering a lot of empathy and support, and then also providing accurate information. Again, there's a lot of misinformation out there about addiction, about substance use, that teens and young people might be getting. They might also have a lot of misunderstanding about what's been going on with us if we've decided to make a change to our substance use. So providing some accurate information can be really helpful and important as well. I also want to just leave you all with a little bit of information and resources about how people do recover from substance use disorders. I won't talk about all of these, but I'm going to give some resources and information and want to give just sort of some additional information on a couple of these. Some people naturally recover. So I mentioned that some people are able to just sort of cut back and make a change on their own. We would call that natural recovery. They don't really get help from anybody or make any changes with anybody else involved. 12-step pathways, you might be familiar with these. This would be things like Alcoholics Anonymous or Narcotics Anonymous. These are readily available, free mutual support groups that you can find really all over Texas and all over the world that provide sort of peer-to-peer, meaning other people with lived experience to help somebody make a change in terms of their substance use. For people that might not be interested in a 12-step pathway, there are a lot of other mutual aid programs out there. One that I will mention here that has a lot of great resources is called Smart Recovery. You can find their website and lots of information on it in terms of making changes to substance use. Smart Recovery is a great tool and resource that helps people learn how to make a change to their substance use. Another one is LifeRing that is readily available, self-paced, and can help people make those types of changes. A lot of people get this type of support through like a faith or community organization that they're already affiliated with. Some people seek out clinical counseling, so that might be seeing an addiction counselor or a therapist or a social worker, sometimes a psychiatrist, to get into some type of treatment program, but not everybody goes into a treatment program. There's also just peer recovery services, things like recovery coaching, which is a professional with lived experience that can help you make a change. Some people find culturally specific pathways to be useful. And then there's a lot of internet-based support available as well, and I'll talk about a few of those options. For online and virtual support meetings, which are definitely available right now and have expanded tremendously with COVID. I have some of the resources here. Online, there is Alcoholics Anonymous, Narcotics Anonymous, Smart Recovery is available online. You can check out In the Rooms, which has tons and tons of resources and meetings for people that are trying to make a change. And then I also like to share even on Reddit, there is a forum for stopping to drink that a lot of people find incredibly useful. It's not meetings, it's just a forum. So there's tons of sort of virtual support out there and available. And there's also some great smartphone applications out there. I have a couple of examples on here. You can see here in the top, there is the sort of the reframe. This is specifically for drinking less or cutting back drinking, where you can track how much you're drinking. Similarly with sort of the daily journal or the recovery path for addiction, there is both sort of sobriety and also like harm reduction or like learning to moderate your alcohol as part of that program. So there's a lot of great phone virtual options out there. If you're interested in any of these, I'm certainly happy to share these slides if you want to send me an email, or maybe they'll be made available. I'm not sure. Or you can, I'll have my email up on here as well, but there's lots of resources out there. If you're concerned about yourself, a family member, a child, you know, there is certainly treatment options, but there's also a lot of other options available to make these kinds of changes. And Andrea, I'll turn it back over to you.
Awesome. Thank you so much, Vaughn. That was a very informative. And I do feel like, especially when all of the drinks were made available to go, and people were so excited about getting their, to go margaritas and stuff. I can remember thinking, well, this is going to be probably problematic, as people are coping with being in lockdown. Okay, so we do have a few questions. One of them is, what types of things are helpful for selecting a recovery path? You mentioned so many awesome ones, virtual, in person, your standard 12 steps, faith-based, culture-based, the SMART program. But how does one go about choosing when there's so many options out there?
Super great question. I would recommend a couple of things. One, trying a bunch out, right, and seeing what is a good fit for you. Reading some of the information and resources available on that pathway. We know that when somebody self-selects into a pathway that sort of meets your sort of ideas about the world, so it fits with your worldview, with your belief system, with your values, you're much more likely to follow through with it. So what we usually recommend for our clients is really sort of a bit of a buffet, right? Like sampling a little bit, being introduced to multiple so that you can find what feels like a good fit for you. Also, sometimes what plays a role in that is practicality. So what's available? Are you going to do virtual, or do you really want to be in person? What are you looking for? And it's a little bit of trial and error as well, sort of figuring some of that out. That's also one of the reasons you can consider something like a recovery coach or a peer recovery specialist, because they can kind of guide you through sort of some of that process. You can also, I will also add, Andrea, that most of them are not exclusive. So if you like a lot of the tools of Smart Recovery, and you like going to AA meetings because you really enjoy the community, you can do both, right? You can kind of, you can go to meetings and you can use an app. You can have a sponsor and have a therapist, right? All of these things can go together.
That's awesome. And that's a really good point about stacking those recovery options. It doesn't need to be one or the other. Good call. Good call.
Yeah.
One question I have is, how honest should we be with our kids when we're having a tough day? I know a lot of my friends, and our generation, our parents, they didn't do anything in front of us, and they didn't fight with each other in front of us. So we didn't see how they resolved conflicts. They didn't drink in front of us. So we didn't have that modeled for us. Mm-hmm. If we asked you how their day was, and actually my daughter's stepdad actually does this often, she'll say, "How was your day?" And he'll be like, "Oh, it was great. It was terrible."
Yeah.
So what level of honesty should we be giving to our children to see how we cope with everyday life so that they don't grow up thinking things are sunshine and rainbows, but without scarring them either?
Recommend age appropriate transparency. So I think it really can depend on the age of your kids. But I think it's totally appropriate to say, I did have a hard day at work. And this is how I'm dealing with it, right? For them to actually see, we sit at our dinner table every night and talk about what happened at work and at school. And my kids see me sort of maybe talking about that with my husband, having those conversations about things that didn't go great, right? I'm not giving them a lot of details about that, but we are modeling sort of those coping strategies for them in an age appropriate way.
Sure. And then I also feel like it would be important maybe to not talk about how bad of a day you're having and then pour yourself a glass of wine at dinner. Keep those two things completely separate, maybe.
Yeah, that definitely could be important. Kids pick up on so much. They pick up on everything, not just what we say, but definitely what we do. So it can sometimes be useful to explicitly say, I had a hard day and I'm going to go for a walk, right? Or but I think really what they're going to pick up on is seeing, I'm saying I had a hard day, and what am I doing about that, right? I'm sort of debriefing and getting some support from my partner, and that's what they're going to notice and sort of learn.
Okay, fantastic. Trying to parent, especially through COVID, has been completely challenging. And so there's a question, are there any age appropriate tools that work well for children who are dealing with recovery themselves?
Mhm. Who have their own substance use or dealing with a parent's?
Probably both.
Okay. Yeah, there are. So for both, for I'll answer it two sort of separate questions. So if there has been sort of addiction or substance use in the family that has directly impacted a child or a young person, there are some great resources and programs out there. For example, the Council on Recovery here in Houston has a children's program, sort of like a camp that they offer a couple of different times a year where they can go and be with other kids who have been impacted. There's also something called Alateen meetings for teenagers, similar to Al-Anon, but Alateen for kids that might have been in a family where there has been an issue with addiction. Alateen also has a great website with some videos and information and things like that. If you've got a teen and who's maybe sort of lived through a parent's addiction. So, and then I think in all of those situations, therapy for the child, whether it's like play therapy or talk therapy for the teen, and the professional can give sort of more specific recommendations if they have them. But I think in both of those cases, support groups and or like professional therapy can be very helpful. The other part of that is if you do have a young person that is misusing substances, I typically recommend starting with an assessment for them. With a young person, we really want to get an idea of like how big of an issue is this? What level of care do they need? What's going on? Just because a young person has, used some substances does not automatically mean we want to send them off to rehab. That can actually really make things a lot worse. So I think starting with professional assessment, we do those at Menninger. There's lots of other places in the community that will do an evaluation to understand, is this a mental health? Is this a substance use disorder? Is this co-occurring? How much are they actually using? That is really the best place to start, I think, for an adolescent. If they do truly have a substance problem, there's a ton of resources here in Houston, alternative peer groups, lots of different sort of professionals that specialize in addiction in young people. But I think starting with sort of professional assessment is helpful.
Awesome. We have a question about the isolation of being at home is difficult for those drinking. Does it help to meet in person for recovery versus online or an app? And then they want to know, what are the advantages of actually going to a real community?
Such a great question. A little bit of that depends on the person. So I have some clients that, like, because of childcare, because of transportation, like virtual meetings are so helpful for them and really a great solution that practically fits into their life because they can actually get to virtual meetings, and getting to in-person meetings is really a challenge. I also have a lot of other clients, and we've definitely heard this repeatedly from our patients at Menninger, is virtual meetings have been really challenging for them. It's not the same level of connection. They're missing out on the relationships. I really often think a combination of both, right? If you can get to in person, again, sort of COVID precautions, to be considered, but in person allows for connections. And a lot of the research we have on why support groups help people change is the value of the relationships that they can build in that community. It's not just what happens in the meeting, but also like the friendships, the relationships, the support that develops around the people that you meet there. And so if you can get in person, at least to some meetings, I think that's incredibly valuable. And also for some people, like if you have social anxiety and the idea of going in person is incredibly terrifying and online is what's going to work for you, like I think there's a lot of individualization there.
Yeah, it sounds like we all just need to take a minute, assess ourselves, assess what's going on in our lives, and then
Yeah.
choose kind of something that's going to best fit what it
Mhm.
is that we are able to do, right?
Mhm. Yeah, what's actually sort of doable for you, and then what's useful for you. And like we were talking about earlier, that might be trying a few different things.
Yeah, for sure. I am curious about natural recovery
Mhm.
and long-term success rates of people who venture down the natural recovery path versus those individuals who seek out any type of additional outside support. Is there data that shows that natural recovery path is as long-term successful as those who seek out any type of support and community? Is that lasting?
Yeah, it's such a great question. So the natural recovery really comes from some recovery surveys that have been done asking people, have you resolved a significant drug or alcohol problem? And so those are people that say, yes, I've resolved a problem on my own. It's not a problem anymore. Now, a lot of those people are saying, I might not use the substance I had a problem with in the past. And so we think about that as some people that maybe have like kind of grew out of it, or maybe didn't have as severe of a problem, might not have had like also mental health consequences or symptoms going on at the same time. So it's not like a perfect comparison because the samples are so different in terms of people that might have a severe use disorder and depression and trauma and really need treatment or need more support. I also imagine that in the group of people that get either professional help or mutual support, some of them might have tried it on their own many times first, and it didn't stick, right? Most people try to stop using a substance multiple times before they actually get it right and before they're actually able to make that change. So that natural recovery is just sort of referring to the people that really kind of made that change without any intervention. It doesn't mean though that they've stopped using completely. It's just they're saying, I don't have a problem anymore.
Oh, that's a really interesting standpoint. It's possible then that something else in their life got treated, right? And then the alcohol or substance abuse sort of resolved on its own upon the treatment of the other.
Yeah, it definitely could be that or maybe their life circumstances changed. They could have moved, they could have gotten out of a stressful situation. There could have been a lot of things. Those are people that maybe didn't have like the same level of addiction severity as well.
It would be really interesting if we had some research on the natural
Yeah.
recoverers. I'm very
Mhm.
curious
Yeah.
about that whole pathway.
Mhm. Mhm.
So you had a slide up that was very awesome about when to initiate a conversation with somebody in their life. Don't do it when you're stressed, especially like your teenagers. Don't,
Yeah.
yeah, you said don't come at them in like an accusing way. Use I statements.
Mhm.
But do you have any tips on how to actually start that conversation? Is it as simple as, "Hi, I'm concerned for you," or
Mhm.
what is the best way
Mhm.
to keep a teenager from doing like the parent block out curtain ignore thing?
Yeah. Oh, it's hard with a teenager. I think it's a couple of things. One, it's about not asking a question and like setting them up. I think is really important. So instead, like if you already have information that you're concerned about, let's say you've learned that they've used substances in some way. I would definitely not start the conversation with a question that's going to maybe create an opportunity for them to lie, right? Instead, because they will lie, they don't want to be in trouble, right? Instead, saying, I know about XYZ and I want to talk to you about that, right? Just being transparent, not creating sort of another problem where they're going to be dishonest. And I want to talk to you about that. Is now a good time? Or do you need, a little time before you're ready to talk about it? I think giving them sort of some agency in that as well. Mhm.
That's a good point. If I think even my 8-year-old, if she does not have a very strong idea of her being able to choose her own path and be independent and can have some control over her own life, she just shuts down completely.
Yeah.
And I definitely am worried about when she's a teenager, because she will totally do that. You kind of, she doesn't ever like even the illusion of a lack of control over her life. And I get it. Nobody likes that. Right. So coming at somebody versus, inviting the conversation are two very different things.
And it can be, I mean, we're sort of both figuratively and literally wanting to come alongside them. So sitting beside them versus like standing over them. We're talking about it in both ways. Yeah.
Oh yeah, absolutely. Body language and nonverbal. I mean, you said it a second ago that kids pick up on our actions probably more than our words.
Yes.
And that's a really good point. I'm going to file that away in my back pocket whenever I need to have a conversation with my daughter, to sit next to her, not like be in front or over or standing over her. That's a good call.
Yeah.
So there's a lot of concern as students start to go back to in-person classes. COVID numbers are still going up. Now we have this Delta variant. I mean, so some of the stressors that were there 18 months ago have not necessarily been relieved, just we are going back out into the world now. And so with that, students, especially middle school and high school, are definitely still under a different kind of stress and more stress maybe than they were back when, they weren't worried about catching COVID. So what are some warning signs to be kind of aware of when it comes to middle school and high school students?
Yeah, warning signs in terms of substance use. We really look for change, right? A change away from sort of what they're normally like, from their baseline. So that might be sort of more secretive, more isolative, change in peer group. If you sort of see who they're hanging out with changing, that's really complicated because things have been so different and abnormal recently, right? But a shift in interests, in activities. You can also certainly look for changes in their behavior at home. With some substances, you're looking for smells, right? With sort of the checking, like, are they no longer making eye contact? Just really any type of change, secrecy, shift in their mood that could be reflective of maybe they have started to use substances. And that's where, those types of conversations, like really focusing on open communication and the relationship, can be sort of protective to be able to talk about those things if you notice them.
Yeah, that's a good point. Whenever there's just like a giant shift in how they are, I guess. It's interesting though, because there are so many different stressors, like everything seems different. Now you mentioned, having to kind of roll with the new normal, and the kiddos are definitely probably taking that kind of hard.
Yeah, I mean, and I would say like it doesn't even have to be big shifts. It could be subtle ones that might not seem important. I know they're teenagers and they're moody, and that's sort of just a given, but sort of any of those sort of subtle shifts like might set your radar off, at least to just be paying more attention to something.
Yeah. Okay. Good point. Are there differences between the drivers in terms of adults seeking substances to cope versus adolescents seeking substances to cope?
Yeah, this is a great question. Yes and no, right? So there's a lot of reasons that people, both teens and adults, use substances. Coping is a very common one. Certainly not the only reason, though, that people use substances. Across the lifespan, people use substances to fit in, right? To socialize. That's true for adults and teenagers. I often think we sort of think about teens using substances because of peer pressure and conformity and socialization, but adults do that too. I can't tell you how often I hear from professionals who say, well, how am I going to go to that work event and not have a drink? Right. So there it looks a little bit different, but it is actually sort of a similar driver in terms of fitting in with a peer group, right? Just a very different peer group. We do see maybe adults end up with substance use disorders because they've been legitimately prescribed medications more than we do with young people, like pain medications or anxiety medications that might have addictive risk. Those are less often prescribed to young people. But most of the other reasons really might look a little bit different in terms of life circumstances, but are going to be actually pretty similar.
That's interesting. I guess it just looks different in adults.
Yeah.
I didn't think about the peer pressure until you mentioned it just now. And there's, I can't seem to go anywhere with friends without them being like, why aren't you drinking? Are you pregnant? Listen, I just don't want to. Why is that hard for us to embrace as a society? That's actually a real question. Why is drinking so normalized?
Well, there's probably a lot of reasons having to do with sort of the alcohol lobby and things like that in terms of really what has been promoted as the common way for us to socialize, to cope, to relieve stress, also to celebrate, right? It is really ingrained in us that, oh, I'm on vacation, I should have a drink to relax. Oh, I'm celebrating an important event, we should have a toast, right? That is just really sort of the cultural norm that most of us are used to.
I did not even think about how normal it is until right now when I blurted that question out at you. It's everywhere. It's so pervasive. Wow. Okay. What types of hiding tactics should parents be aware of that their teens might attempt for sneaking the alcohol into the home and at school?
Oh, yeah. This is a great question too. There is a lot of different ways, and people that are trying to get away with using substances are incredibly creative in how they can hide things. Certainly, I always recommend to parents to any alcohol you have in the home to make sure is locked away, to remove other substances from the home, like old prescriptions, to also keep track of over-the-counter medications that have sort of a misuse potential, inhalants, cough medicines, sort of things like that we don't necessarily think of, but that young teenagers and early adolescents are more likely to misuse because it's what they have access to. We see that both the inhalants and sort of the over-the-counter cough medications are common as early as 8th grade. So yes.
Wow.
So checking sort of things that right? Not keeping things in the home, keeping track of those kinds of things and locking them up, particularly the alcohol, keeping locked up, because we certainly know young people will steal alcohol from their parents. When I interview teenagers very regularly, the story of how they first tried alcohol is taking it from their parents. And the parents not knowing because they're not keeping track of how much alcohol they have in their home. Other sort of strategies, though, that we see young people regularly, it might be put into a different type of container, like a water bottle. I hear a lot of stories from teens like taking alcohol to school in water bottles because it's inconspicuous, it's not noticed that it's alcohol. I think that depending on sort of your agreement and plans with your kid, like being able to check their room, without an invasion of privacy. So it would need to be a sort of an understood conversation about like being able to check their room for paraphernalia. With marijuana, it's very easy for to hide sort of vaping devices. They often look like they don't look like vaporizers, right? They look like USBs. They can really be very easy to hide.
Wow, that's a lot. USB vapes, that's interesting and scary. That's very scary as a parent, especially as a parent who I come from a long line of family members who have dealt with substance abuse pretty severely. My mom was a heavy drug user when I was a kid, and we grew up with it in the house. It was basically completely normal. I have had many family members struggle with this. So, of course, this is something I worry about with my daughter. So, what are, and I hear often about like addictive personalities. Can you speak to whether or not that's real? And if so, how to, aside from all of the phenomenal tips that you've given, have honest conversations, keep it locked up, make sure that we model healthy coping. Is that also something that we need to be honest with her about? I'm not sure.
Yeah. I do think, again, age appropriate sort of honesty and transparency as she's getting older, and you're having those conversations about family history and risk within your family, that, right, you may not be able to drink or try substances the way some of your friends are able to because of this family history, right? I think it's totally appropriate as they get older to talk about that. Mhm.
Awesome. I will definitely keep that in mind. I just, I just worry. I don't want her to think badly about her grandparents, but at the same time, we do need to be aware of these things. And I often wonder if somebody had been honest with my parents and my parents had been honest with me, if things would have turned out a little differently.
Yeah, I mean, to your question about like just the risk, right? There's no such thing as an addictive personality, right? That's not really a thing. What is sort of a very real thing is the heritability risk. So the genetic risk, like 50% or greater in terms of inheriting risk for sort of addiction and other what we call like sort of behavioral health or sort of externalizing problems. So somebody might just sort of inherit a general risk towards having behavioral health problems. It doesn't mean they're going to have an addiction necessarily. They certainly might be more likely because of the genetics, if they're exposed to substances. There's so much research happening right now on like genetic risk, even with specific substances, and how people can be sort of genetically predisposed to or protected from certain kinds of substances, even. So that's why I think talking just about the general risk, like being mindful of that. But it's not like a guarantee, and they're not going to necessarily have an addictive personality.
Okay, so 50% risk just from genetics straight up. So that means the protective conversations and the protective measures are even more important.
Yes. Also, though, remember that, right, there's the interplay of genetics and environment. So, which can be sometimes difficult to separate, right? But having that family history is not like a guarantee that somebody's going to develop an addiction. And just because somebody doesn't have the family history also doesn't mean they can't develop an addiction, right? We also see people that don't have family history that end up with substance use disorders and addictive behavior, because it's the repeated exposure to the substance that develops the addiction.
Sure, that makes sense. All right, we are winding down on time here, so I have one more question from the audience. And that is, I have read that high achieving students turn to energy drinks and drugs to deal with the workload. So what tips do you have for parents who have high achieving students to kind of encourage them to take their studies and their schoolwork seriously, but kind of without crossing the line into pushing them into over-the-counter prescription or even illegal substance abuse in order to cope with that workload?
Certainly those types of sort of over-controlled, high-achieving individuals, what we do see, like the caffeine use or the stimulant use disorders, right? Like getting into misuse of like prescription stimulants like Adderall. Definitely risk there for young people and adults with sort of that sort of just type of personality. I think it's a lot of the same protective factors we've been talking about in terms of using those conversations to express concern. I also think it is modeling like engagement and leisure and downtime for them and helping them do that. Like, what is your expectation for them as a family? Do you play? Do you take a break? Are you modeling and teaching them that? Or also, are you kind of always overachieving and communicating that type of expectation? Because a lot of that definitely can be learned. Sometimes it's more innate as well. And then that's really about helping them develop coping strategies for dealing with sort of losses and setbacks and having reasonable expectations of you having that of them and them having that of themselves. And that's also something that like a professional counselor or therapist can help them with if they really are that sort of overachieving and perfectionistic. Mm-hmm.
Awesome. Well, thank you so much, Vaughan, for taking your time to speak with us today. We love doing this series with the Menninger Clinic, and we have another one coming up on November 4th. The topic for that one is parenting in a digital world with Mallory Mintzberg. As always, that conversation will be taking place from noon to 1 over your lunch break. So thank you so much for Vaughan. Thank you so much for our listeners today. You guys have a great rest of your week and an awesome weekend.
Thank you, Andrea.
Have a great day.